Hi, I'm Dr. Steve Yip from the Tom Baker Cancer Center and BC Cancer. I'm presenting an abstract from BC Cancer in regards to a predictive model developed to identify patients with metastatic prostate cancer at high risk of germline DNA damage repair mutations. We thought that this was a significantly important issue as there is only guidelines to help identify these patients, and we have yet to see data that significantly supports this to help clinical and pathologic characteristics that can guide who we should be testing for genetic testing. So we sought to identify out of 631 consecutively sequenced patients in our liquid biopsy program, patients who had germline DNA damage repair alterations, contrasting them to control wild-type patients. In doing so, we performed a multivariable model analysis to develop a predictive model with a weighted scoring system. We contrasted 29 versus 128 germline DNA damage repair altered patients versus control wild-type patients, looking at their clinical and pathologic characteristics. We found that through univariate and then multivariate modeling that intraductal cribriform pathologic subtypes, visceral disease, and those individuals who had a primary family history and possibly age were good factors in identifying patients at high risk of germline alterations. When we did this by multivariable analysis, using any of these criterion, we were able to score patients. So we believe that potentially those individuals who have intraductal cribriform histology, visceral disease, primary family history of prostate cancer, ovarian cancer, pancreatic cancer, or breast cancer, and then potentially age less than or equal to 65 years old, should be considered for genetic testing. This is preliminary data, and our model is currently undergoing external validation, where we have collaborators working with us from Tulane University, specifically Dr. Oliver Sartor. And our data will be forthcoming with final results where we will publish this in a manuscript. In the interim, we think that these factors are compelling and potentially may guide how we select patients who should be genetically tested. Thank you very much for your time.